Welcome to Chillin' 101. We hope this video helps.
You start by quickly assessing life threats: airway, breathing, circulation. If any are abnormal, call emergency services immediately. Once those are stable, support the injured limb in the position found using a splint or rolled towels to prevent further damage. You should cover any open wounds and apply ice for short intervals to reduce swelling. Make sure to keep the person calm and still, because muscle spasm increases pain and can worsen displacement while you prepare for transport. You manage pain and anxiety next, because relaxed muscles make reduction safer. Administer analgesics only if trained and appropriate. Once pain is addressed, avoid forceful manipulation. Instead, provide steady, gentle support to reduce muscle tension. Prepare the scene. Gather sterile supplies. Consider Roman IV access and procedural sedation if in a clinical setting, and ensure imaging is available to confirm anatomy. Make sure to communicate steps to the patient so they can breathe deeply and relax, which helps you proceed with controlled movements. You perform a gentle reduction using the accepted technique for the specific joint, applying steady longitudinal traction, then guiding the joint surfaces together. Stop immediately if resistance spikes or pain worsens. Once reduced, obtain imaging to confirm proper alignment and to exclude fracture. Make sure to immobilize the limb in an appropriate splint or sling, monitor distal pulses and sensation, and arrange timely orthopedic follow-up. If swelling or numbness increases, return for reassessment.
Thanks for watching. Consider subscribing if we helped you.